Hi, my name is Danielle Crum, and today I will be performing a head-to-toe physical examination for week 1 of health assessment class at McKendree University for Miss Pionteks class. Okay, this is Mr. Sumner. He has come to the office today for a routine physical exam. We have already taken the patient's history and interview. From the history and interview and his walk in the office, we've been able to see his general survey and note that he generally appears to be well. He has no difficulty breathing. He's of lean build. We have measured him at 6 foot 2 inches and 170 pounds with a BMI of 21.89, which is healthy. His facial expressions are appropriate. Posture, gait are normal. His dress is normal. Grooming is normal. No odors and mannerisms are all normal and appropriate. Okay, now I'll start by taking his vital signs: blood pressure, pulse, count his respirations, um, temperature, and pain. Are you in any pain? Okay. We're going to begin with the head-to-toe assessment. First, he's alert and oriented ×4. I'm going to examine his head. I'll be looking for scalp depressions, texture of hair, nevi, scars, anything abnormal, everything looks good there. Next, I'll check his eyes and look up and down. His conjunctiva and sclera. I'm going to look at his pupils, if you look ahead, and make sure that they are equal and reactive to light, and check accommodation. Based on our interview earlier, I know that he is able to hear. And do you wear any hearing aids? Okay. Do you wear glasses or contacts? Okay. We can check sensation by feeling. You feel sharp? Sharp. Next, I will go down to the sinuses and pressure. If there's any tenderness. No? Okay. I'm going to go ahead and look at his nose and his mouth and look up. There's no deviations and mouth open. See no ulcers, no sores, nothing around there. Going down to the neck, I will check carotid pulses on each side and go ahead and feel for the lymph nodes. And feel the cervical chain. And then from behind, I'll palpate the thyroid gland. Okay, go ahead and check skin turgor. There's no tenting, that's fine. Okay, I'm going to go ahead and listen to the lungs in 10 areas, going from side to side, with deep breaths in and out at each point. And laterally. Okay. Now I'm going to listen to his back and examine his back. He'll have his shirt off. I'll be looking for any nevi, scars. If there are any nevi, the A, B, C, D, E. And I'm going to listen and percuss. Okay. We are going to go ahead and do an assessment while he's standing. Yeah, over there. Okay, face me. Okay, close your eyes and put your arms out forward. All right, we are assessing for any swaying and arm droop. Can you alternate one finger to your nose and the other? Okay, and we've assessed his hand coordination and motor movement. Okay, come to me and face that way. Okay, can you take a few steps that way and then turn around and walk back towards me? That's good. Okay, now turn around and do the same thing on your heels. And then turn around and walk back to me on your toes. Okay. Now turn around and, alright, lean forward, touch your toes. Alright, check the vertebrae and check for spinal alignment. And stand up. That's it. Okay. Okay. Now we have our patient lying supine. We are going to look at the thorax and lungs first. We're going to palpate and observe for symmetry, any masses, lesions, any pulsations, peristalsis, or masses in the abdomen. We can listen to the heart sounds here as well. And you can assess the apical pulse with the radial pulse. Assess for any differentiations between them. And moving to the, actually with cardiovascular, you can look at jugular vein pressure. And we can listen to the carotid pulse and listen for bruits. And we can roll the patient slightly to the left and listen for diastolic murmurs. Okay. And then continuing with cardiovascular, check the peripheral pulses, down to the legs. Can't see me. Okay. And the abdomen, we will observe first, then auscultate, and then percuss so that you don't cause any changes in the vowel sounds from your palpation. So we're going to listen to all 4 quadrants. And vowel sounds are present in all 4 quadrants. And listen for up to 5 minutes to make sure that they are not hypoactive or absent. We can then palpate light to deep, palpate for masses, then you can palpate for the kidneys, and percuss the span of the liver, palpate the spleen, and percuss the span of the spleen, and then palpate the kidneys. Okay. Then we're going to move on to the extremities. Okay, now we're going to check the extremities. We will check the hips, knees. We'll look at muscle atrophy in the thighs and check for edema. There's no edema. Check the peripheral pulses, dorsalis pedis. We will dorsiflex and extend feet. Check for range of motion, which we also noted when he was walking with his gait. We can look at color and temperature, feel temperature, assess the toenails and thickness of the toenails. Check for capillary refill. We can do that on the fingers as well, and check for clubbing. Check for sensation, and if you have a hammer, you can check reflexes.